Are you a gestational diabetes patient or meron ba kayong gestational diabetes during pregnancy? And I would like to share with you my experience, my journey in this gestational diabetes pregnancy. So ano nga ba ang gestational diabetes? First disclaimer, I'm not an expert and I will just share it based on my experience, based on the knowledge that the doctor has shared with me. So, ang gestational diabetes, it only occurs during pregnancy. And malalaman mo lang na may gestational diabetes ka if you have done your glucose test during your pregnancy. What will happen in the glucose test is yung magfa-fasting ka for 8 to 10 hours and then they will extract your first blood sample. And after extracting your first blood sample, you will be drinking yung glucose drink na sobrang tamis na kailangan mo ubusin. And after that, you will be waiting for 1 hour. And then after 1 hour, they will be taking your second blood sample. And then after that, you will be waiting for another 1 hour. They will take your third blood sample. So all in all, you might need to wait in the hospital or in the clinic or laboratory for about 2 to 3 hours. And then after a day or two, I received a call from the nurse saying that I have a very high blood sugar results and I am a gestational diabetes and I need to see an endocrinologist right away. During that day that I received the call, I was very worried because it was my first time having gestational diabetes, and the first pregnancy that I had, I didn't have those, so it was a new experience for me. And I would say the difference between nung una kong pregnancy and my second one, sa una kong pregnancy, that I was very health conscious kung ano yung kakainin ko, kung ano yung dapat kong gawin. I was still doing exercise because it was my first pregnancy. And during the second one, I will not say na nagpabaya ako. I was more relaxed during the second pregnancy na I was eating, but I was not eating too much because during the second pregnancy, I was vomiting until the third trimester. Pag kinain ko na siya, maya-maya ayoko na siyang kainin. So, I was not eating much. What I could remember so far is much more fruits ako this time, and also I was eating cereals, and we know that cereals are packed with sugars, and I think that was maybe one of the biggest contributors of it. When I found out that I have gestational diabetes, sobrang worried talaga ako. Hindi natin may iwasang mag-Dr. Google, and you are seeing lots of things in Google giving you that worry. So number one, please do not do Google. If you have a contact with your doctor, you can email them or give them a call. So I said, okay, I will not dive or I will not give this negative thoughts. I'll just wait for my visit with the endocrinologist. So I did. It was a day or 2 days after when I received a call na na-meet ko yung aking endocrinologist, and he was telling me my glucose results were so high and expect that I will be doing insulin injection every day. But he said, since it's your first gestational diabetes, let's monitor your sugar. Let's see whether once you come back after 2 weeks, we'll do your insulin injection. Doctor said that I need to monitor my sugar 7 times a day. And how do you monitor your sugar? Traditional way, you will do the traditional pricking na merong parang ball pen, tas iprick mo yung finger mo, and then you will put it into a paper or a glass, and then you will have it in the little gadget to read the sugar. That's a traditional way. Now, meron ngayong bagong technology, which is it's a sensor type that you can monitor your sugar 24 hours a day without doing the pricking 7 times a day. This is the freestyle sensor, which is going to be sticked in your upper arm. So this one. There's a needle that will be stuck in your upper arm, and then there is an app on your mobile phone that you can track your sugar 24 hours a day, and also it's connected to your doctor or to your hospital's app as well. They can also monitor your results so hindi mo siya madadaya, and they can also see the trend, for example, kumain ka and then kailan nagfa-fluctuate yung sugar mo throughout the day. So I'll show you the app later, and now I'll show you how we are preparing for this sensor, paano siya inaalis, paano siya kinakabit.
Here's the existing sensor stuck in my upper arm. Just simply peel the sides like a band-aid slowly. Wash your arm with soap and disinfect with an alcohol. Make sure to dry out the area. Let's open the new sensor, which comes with 2 pieces. Make sure that the line between the 2 pieces are aligned together when you combine them. Once you combine, pull it out and you will see the needle already attached. Stick the sensor yourself or you can ask someone to place it for you. Now open the app and make sure your Bluetooth is open. Just place your phone on top of the new sensor to establish connection. And your sensor will be ready after 1 hour.
You need to change your sensor every 14 days. And I was thinking at first, siguro pwede mo naman siyang i-extend ng 15 or maybe 20 days and so. Unfortunately, no, because in the app itself, meron siyang sensor days, 14 days remaining, 13 days remaining until matapos siya. So, hindi mo siya pwedeng dayain. The reason why, kung naisip yun kasi, as you can see, it's a bit pricey. Here in hospital where I'm getting this, it's 301 dirham. So, if you're going to change it every 14 days, means it's like twice a month. It's 602 dirhams per month. Medyo mabigat siya. But the good thing is, hindi mo ipiprick yung daliri mo 7 times a day in the duration of your pregnancy. And the doctor said that once you are considered as a gestational diabetes, you need to monitor it until the end of your pregnancy or even after a few weeks of your pregnancy. So it means that if you're doing the traditional thing, it means that half of your pregnancy, you need to do it. Hindi ko kayo tinatakot, I'm just stating the fact. First 2 weeks of my sugar monitoring, the doctor told me na wag muna tayo mag-insulin injection, let's monitor your sugar. So I was prescribed with metformin, 500 grams. Please make sure you talk to your endocrinologist or to your doctor first because they will be the one who knows what's best for you. Listen to them, and this one is just for my own situation, so it might be differ from one pregnant woman to another. And then in the first 2 weeks of the sugar monitoring, and I can see it in my app, na nag-try and test ako ng mga combination ng food, ano yung reason why my sugar is fluctuating. And I can see that it is the jasmine rice that I was eating na talagang nagko-contribute on the fluctuation ng aking sugar. So makikita ko talaga yun after 1 hour, after 2 hours. The app itself will alarm like tit, 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 if it is more than the glucose range na sinet. Because in my glucose app na sinet ng doctor ko, the maximum sugar that within the range is 140. So beyond 140, if it becomes 141, it will give you an alarm, toot, toot. You know that, okay, your sugar is quite high. The number one contributor to sugar is apart, of course, from the sugar itself, is carbohydrates. So we are getting those carbohydrates from rice, from pasta, from bread. So you need to check any alternatives on those carbohydrates. The doctor told me you still need carbs, but you need to control how much carbs you will eat. And I also actually met a dietitian or a diabetic educator regarding about it. Saan nga ba nagagaling ang gestational diabetes? What's insulin? Type of food that I can eat? And so on. I couldn't remember everything, so I don't want to provide wrong information. So she told me that if I will be eating like in a proper meal, my carbs should be only the size of my fist. It's a small portion of rice, and then I can eat protein or meat as much as I want, but the carbs should be only the size of this one. Or if I would also have a dessert on the side, I need to choose between the two. And I cannot have the fruits at the same time as I have my main meal. So I need to have the fruits as a snack. That's a number one advice that she gave me. So that's what I was following. But what I noticed is during morning, pagkagising ko, mataas na talaga yung sugar ko. To think that during the nighttime, you're not eating anything, it means you're fasting. And paggising ko sa umaga, I was checking the app and my sugar is already around 100 plus. So it means that if I eat something in the morning with carbs, like tayong mga Pilipino, we are ricivores, as I call ourselves. Now from morning, lunch, and dinner, we're eating rice and sometimes even snacks. So in the morning, di ba mahilig tayo sa sinangag, sa fried rice, and I was eating fried rice. And I was noticing na even super konti lang nung kinain ko, talagang more than 140 siya. So what I did was, I skipped the carbs in the morning, which is very difficult. It's difficult na kapag hindi ka buntis. Then it's more difficult kapag buntis ka. So it takes a lot of discipline not to have carbs in the morning. Or I'm having carbs during lunch and dinner with the size of the fist. Sa mamapak na lang ako ng ulam. And then I also experimented on fruits, eating banana, oranges, and so far, yung safe na fruit is banana and avocado. And the second thing that can help you control your sugar is doing light exercise. So my doctor told me that I can do walking, even like 15 or 20 minutes na I can do after meal or even before sleeping para at least least ma-burn yung mga kinain mo or yung carbs or yung sugar na meron sa katawan mo. And then after 2 weeks that I went back, my doctor was so happy because I was able to control. It's very difficult, I'm telling you. Up until this point in time, it's very, very difficult to control what you eat. So after the 2 weeks, I was already worried I will be doing insulin injection every day. And then when we see the results in the app, he was so happy and he said that we can delay your insulin injection, your results are good. And the only thing that he noticed was na kahit tulog ako, pagkagising ko sa umaga, my fasting sugar is still high. And we wanted to lower down to 2 digits. We increased the metformin from 500 to 1,000 milligrams. That also solves the issue. I already know the food na nagkakos ng sugar, so I was avoiding that as well. Fast forward, thank God, I'm still not having my insulin injection, but the doctor said that as I progress with my pregnancy, I will be much more sensitive to sugar or carbohydrates. Hindi pa rin mawawala na there's a possibility that I will be doing insulin injection. The doctor said I'm already one of the best patients na I've done a great job being disciplined to control my food and able to delay the insulin injection as much as we can. But it's holiday season, a lot of parties. Akala mo naman ang daming parties, you know? Mas masarap kumain dahil may dahilan ka holiday season. But I still try to control myself. This particular video is I would just like to share this experience to the mommies out there or mommy-to-bees that are also pregnant and having gestational diabetes. Just hang in there, follow what your doctor tells you. And the second thing is, bakit nga ba natin kailangan disiplinahan yung sarili natin on this gestational diabetes as much as we can? Or if you're able to do that, ano nga ba yung mangyayari? Why we need to control the gestational diabetes situation during pregnancy? Number one, of course, it's for your health. The doctor said that the gestational diabetes will go away kapag nanganak ka. Pero there are instances as well na it also stays with you. Na either you're also considered as pre-diabetic after your pregnancy or it goes na directly to type 2 diabetes. So that's number one. It's for your own health. Second thing is, of course, hindi lang ikaw yung maapektuhan but your baby inside you as well. Since ikaw ang source of food niya, is ikaw ang source of nutrients, if you have too much sugar in your body, ang pinapakain mo rin sa baby mo is sugar, then it may cause as well, you know, either bigger baby or like smaller baby. And the number one that I was very worried nung nalaman ko is yung kapag inanganak mo na siya, since hindi na ikaw ang source of food niya because syempre nakatanggal na siya sa'yo, the baby's body will find where's the sugar. He or she cannot find the sugar na nasanay siya sa loob ng tiyan mo. It can be a possible cause na maniko siya or you know, more complication that might happen. And baka nga dahil mas malaking baby siya, pwede rin magkaroon ng birth trauma, and so on and so forth. So, it's not just about you, mommy, but it's for the own health of your baby. So, that's my actually worry. My priority is my baby, then second priority is myself. But yun, kaya ako talagang pinupursige na I'm trying to be disciplined as much as possible because it's for my baby. And we want, of course, a healthy baby and a healthy delivery as well, and less trauma as much as possible. So, I'm sharing this video not to scare mommies out there na may gestational diabetes. I'm here to share my experience and also to share na kaya natin to, mommies. I'm not saying it's easy. It's very difficult to control yourself on the food that you eat, especially during pregnancy. You try to find ways kung paano mo makokontrol yung sarili mo for carbohydrates or directly sugar. If still nagpuput kayo ng sugar, go for stevia. It's a good alternative. My doctor also said that, okay, good, you're using stevia as well. So, go for that. Yun. So, mommies, kaya natin to, and I hope that this gives you quick overview of a journey of a mommy or a mommy-to-be na merong gestational diabetes condition during their pregnancy. Kaya natin yan, and hold on tight. Do not believe in hearsay. Check with your doctor if you are still worried. Get a second opinion. There's nothing wrong in second opinion, but second opinion with still a medical expert, not a hearsay. Kasi may hindi rin magandang maidulot sa mental health natin ang mga sabi-sabi. But I'm not saying na wag natin yung pakinggan, but better if it's especially your health condition to check with a professional. Listen to your doctor, listen to what your body say, and kaya natin to, mom, and see you and have a healthy pregnancy journey. Bye!